We need to retrain our brain in order to heal from chronic pain and symptoms. Our brain has an amazing ability to learn. We're really good at it. Think about a baby in their first years of life. When my children were growing up, it was fascinating watching them learn day by day all sorts of new things, whether it was learning to talk, walk, take their first steps, ride a bike, think and problem solve. And so learning brings so much to our life. Now, the dark side of learning is that our brain can learn negative things that are not useful for us, not helpful for our life. This can include anxiety, depressive symptoms, but it can also include things like chronic pain and symptoms. So whether your pain started or your symptoms started from an injury, an emotional event, a traumatic event, however it started, once the pain or symptom sensations have been occurring for a while, your brain is learning them better and better day by day. And so this is why people that come to a mind-body approach earlier than others tend to heal faster, because their brain hasn't learned pain or symptoms really well yet. So this is neuroplasticity. Neuroplasticity, I can't say that word. Neuroplasticity. What this is it's the fact that your brain can learn or unlearn things. Basically, neurons that fire together, wire together. And so our brain can learn in all sorts of situations when to turn that pain or symptom switch on or off. Now, our medical system, it's not brain and nervous system focused when it comes to chronic pain and symptoms. So right out the gate, when you go to your doctor with pain or symptoms, you get examined, you get evaluated, which is useful. I don't want to deter people from doing that. It's good to be responsible for our health. But then comes all the physical treatments. We throw everything at it. And for myself, it just didn't work. It didn't matter what physical treatment I did, my pain and symptoms were just getting worse over time. And so what I needed to do was actually focus on my brain, on doing brain retraining exercises. Now I'm going to go through some of these brain retraining exercises with you so you know what you need to focus on in order to heal from chronic pain and symptoms. Because if your brain can learn to have pain or symptoms, it can unlearn them as well. Dr. Schubiner, that's basically the line of his novel, his book. But it's possible. If your brain can learn pain or symptoms, it can unlearn them. And in order to do that, we need to use brain retraining exercises. So let's dive into a few examples. Creating new beliefs about your pain or symptoms. Early on, when I'm working with someone, I'm helping them gather evidence. I'm helping them gather evidence that their symptom is neuroplastic in nature, meaning that it's a brain and nervous system issue. And the reason this is so important is if the brain keeps believing that the body's damaged, it will just keep producing that pain or symptom. So part of brain retraining is actually creating new beliefs. And the way we do this is we gather evidence. We gather evidence that our pain or symptom is behaving the way neuroplastic pain or symptoms behave. And so gather that evidence. In the video on the top of my YouTube channel, I go through some of the criteria. Also on my website, I have a really useful blog post that you can check out about the criteria for neuroplastic pain and symptoms. But it's starting to gather that evidence so that you can change your beliefs about your pain and symptoms. Challenging and changing thoughts. When we have chronic pain or symptoms, all of our thinking gets really negatively slanted. I remember this. Everything was negative. I became an expert at it. And to be fair, before that, I was a pessimist. But when we have all these thoughts about our symptoms that are really negative and really scary and really catastrophizing, it can be hard to heal. So part of brain retraining is challenging and changing your thoughts. Now I have a really useful skill called the 3R skill. I'll link it to the top. I have another video on it. It can help you start to challenge and change your thoughts and shift out of your mind and into your body. And by doing this, we can learn to have more balanced thinking and also regulate our nervous system. Visualizing yourself healing and being able to use your body. When I was first recovering, this is something I did a lot of. For so long when I was in chronic pain, I constantly was viewing how my body was damaged and how I couldn't do things. And I even visualized how my spine was all messed up, which if you want to escalate your pain, that's the way to do it. And so what I did early on is I did a ton of visualization. And it was hard at first, but I got really good at it over time, where I would sit, or actually at the time I was lying in my bed because I still had a lot of pain. I would lie there and I would start to visualize myself being able to live life, or being able to move my body, or being able to connect with people without having chronic pain. And so visualization, it can be difficult to do at first. It's best to do when you're in a more regulated state, but we're actually retraining our brain through visualization that we are able to do these things and be pain and symptom free. And at first I did this a lot, like probably an hour a day. Little overkill, you don't need to do that. But I was helping retrain my brain, teaching it we can be pain free while we live our life. Somatic tracking, one of my favorite topics in terms of mind-body topics. I have lots of somatic trackings on my YouTube channel, but what somatic tracking is doing is it's changing your emotional relationship with your pain or symptom. It's vital for anyone recovering. Somatic tracking is going to be vital to change that emotional relationship and teach our brain during the tracking that the sensations of pain or symptoms are actually safe and we're not damaged. It's a great brain retraining exercise that you want to engage in. And so somatic tracking, doing this daily can be really important, but it can really start to change your relationship with your pain or symptom and help create safety in the body. Graded exposure. Now, somatic tracking is a form of exposure, but graded exposure in general is often needed to unlearn chronic pain and symptoms. And what we're doing is we're giving our brain new experiences in new situations. And we're doing it slowly, but we need to do this to teach our brain we're safe to use our body in these different ways. One thing that happens with chronic pain and symptoms is our life gets really small. And I empathize with anyone listening because my life was so small by the end, I was barely doing anything. But all that avoidance, what it was doing, it was teaching my brain that it wasn't safe to use my body in any way. So I needed to use graded exposure so that I could start using my body again and retraining my brain that it was okay to do that. Now, somatic tracking can be a useful thing to pair with your graded exposure, but we need this in order to overcome chronic pain and symptoms. We need to approach. We're not going to heal by avoiding. So these are a few brain retraining exercises that can help you overcome chronic pain and symptoms. Now, the next question I usually get is, how do I go about doing these? And so the way you use your brain retraining is really important. So the first thing is take the pressure off. We're not going to heal by putting a bunch of pressure on using these techniques. The goal is creating safety. So the first thing is take the pressure off. The second is actually getting into a regulated state as best you can before you do the brain retraining exercises. If you pick the time of day when you're most anxious or you're most in despair, it's going to be really hard to get into a good headspace to do the brain retraining. So try to regulate your nervous system with some deep breathing, some polyvagal breathing, or some light movement, something that calms your system before you engage in it. Now, the next thing is you want quality over quantity. Of course, you need to do the brain retraining exercises, but go for quality. You don't need to do this 30 times a day. That's just going to increase the pressure. And lastly, I know it contradicts it a little bit, but be consistent. If we only do the brain retraining once a week or a couple times a week, it's not going to be enough because your brain has all these other experiences that are reinforcing chronic pain and symptoms. So we need to give it consistently new experiences that were actually safe, and we can change our thoughts, we can change our beliefs, we can change our emotional response to the symptoms, and we can re-engage in life. By giving your brain new experiences consistently, it will help you heal. So I hope this video was helpful. Please put your questions or comments down below and go retrain your brain.